Hi guys, in this video I'm going to be talking about 10 areas you didn't know you could inject with some Botox. Okay, so for the first area I'm going to be talking about is brow lift. So you can inject your brows and get a really nice lift using Botox. Depending on what you're trying to do, you can really achieve a different brow shape with Botox or Dysport and achieve a really nice lift, shape the brow. So typically we use about 4 to 10 units to achieve that kind of look. And it's very quick, it's very easy, and doesn't require too many units. The next 3 areas I'm going to be talking about are on the nose. So you can definitely do your gummies, which, not your gummies, sorry, your bunny lines, which people already kind of know about. But you can also slim down your nose a little bit by injecting right in here. What that's going to do is it's going to suppress your nasal flaring so that when you're talking and with expression, your nose doesn't flare this way too much. You can also do the nose tip lift, and it's an injection right at the base, and it's going to lift the tip ever so slightly. And the third nose injection would be just doing on top of the nose right here. And it's a superficial injection, and what that's going to do is it's going to suppress the production of oil so that your nose doesn't end up being too oily. And I've actually got a video of me doing this for the first time, which I'm gonna link right here. And if you're interested in seeing that, you can always do so. So typically with the nose tip lift, we're looking at about 3 units. In here, we're looking at about 4 to 8 units. And then with the nose on top, you're looking at about 4 to 6 units, and that's what we would do in order to achieve a result. Another area I love injecting because it makes such a significant difference, yet it requires so few units, and it makes people's smiles look that much better. And that's the gummy smile correction. So we would inject here and here. Some people, when they smile, you see a lot of gums on top of their teeth, and some people don't like that. So we can definitely inject here and here, and that's gonna lower the lips so that when you smile, you're not showing any gum on top. And that typically requires about 4 to 8 units. So it's really not much in order to achieve such a drastic change. So now I'm going to talk a little bit about around the lip area. Obviously, the one that people are always surprised to hear about and love trying out is the lip flip. So the lip flip just involves injecting right on the lip border, a lot less painful than lip filler, a lot quicker. Again, requires about 4 to 10 units. I always start people off on 6 units just to be safe. And what it does is it relaxes the muscles so that when you smile and at rest, you're showing more lip. So it relaxes the muscle here so that inherently just show a little bit more lip. It's a lot more subtle than filler. It's not gonna give you a filler result, and it doesn't last as long too. It lasts about 6 weeks for most people, and that's just because it's such a low dose. And the reason why we do such a low dose in that area is because we don't want to impede your ability to speak comfortably. That is an option for people who don't want really to do lip filler, and they kind of want to enhance their lip a little bit more. The next area would be smokers lines. Sometimes smokers and non-smokers, we call them smokers lines or barcode lines even, are lines that occur going vertically on top of the lip. And a lot of people don't like that, so we can do a little bit of Botox in the upper lip here to kind of try and soften out those deep wrinkles. Definitely something that's very hard to treat and typically would require a combination of fillers and Botox, but even then you're not gonna get 100% result. They're definitely really hard to treat, but it's definitely something nice that you can do in order to enhance that area. The other area to enhance your lip area would be the DAOs, and the DAOs are just muscles going down here from the corners of your mouth down to here. And they're they're the muscle responsible for pulling your corners down. So some people at rest, especially with age, the corners of their mouth starts to droop. So if you look at yourself in the mirror and you're not making a face and your face is sitting like this, then you can inject your DAOs, and that's gonna lift the corners up. Typically we do about 3 to 8 units per side to resolve that, and it gives a nice subtle result, and it changes your facial expression. Another area we inject that you may not know about is the chin. So some people, when they talk or even at rest, they tend to put a lot of pressure on their chin and do this dimpling of the chin. They talk, or even at rest, they're just so active in this area and they purse their lips without even trying. They're kind of just sitting like that, or even while talking. And so we can inject a little bit of Botox to relax this muscle so that you don't get that dimpling that happens. Some refer it to the orange peel. Personally, I don't really think it looks like an orange peel, but whatever. Okay, and another area that you may not know that you can inject with Botox is the masseter muscle. And I feel like it's getting a little bit more popular these days, but basically, if you have more of a squarish face shape or your masseters are enlarged and you want to achieve some facial slimming, then this might be the area you need to inject. It's also injected for people who have TMJ, other jaw muscle issues, and it relaxes the muscle, but it also atrophies the muscle, meaning making it smaller. So if you inject this area, you can slim down your face if you're a candidate, of course. And typically in each masseter, we put about 15 to 40 units on each side. And the last area you didn't know you could inject with Botox is your armpits. So if you're experiencing excessive sweating, you can always inject your armpits with some Botox, and that is gonna significantly reduce the sweating. I've had it done before in my hands because I used to have sweaty hands, and it's super effective. Note that if the other areas you can get it done is in your hands and feet, and those areas are super painful, but in the underarm, it doesn't even hurt. It's very tolerable. Typically, we would put about 50 to 100 units per armpit, usually 50 for women per armpit, 100 for men, or 75 on each side per men. And it gives a great reduction of sweat. It makes people feel way more comfortable. It's one of those areas that, you know, people get insecure about if they're having excessive sweating. So it's always good to consider Botox. It's super effective for that. Thank you so much for watching my video. I hope you learned a thing or two from this video. Feel free to leave a comment down below, and I'll see you guys in the next one. Bye.